Without further ado, let's welcome Dr. Francesco to start his presentation. Francesco.
Thank you, James, for that kind introduction. And for me, it's a really great pleasure to have the opportunity to share with you and the group of four my lecture. Yes, I started as a dental technician, and for me, it was really, I'll say, interesting because it's then you can understand better the two words that sometimes are in antagonism, but in my opinion, what we have to do is to work as a team. And so today, together, we are going to see different aspects that most of the time are the reason because in some cases we cannot obtain the result we have in mind. So of course, every single time we start with a full mouth rehabilitation or rehabilitation, in any case on implant or natural teeth, our target is always, how to say, to create a beautiful, a beautiful result, a beautiful smile. And this is, for us, it's, I would say, the target. Much more, what I consider important that we have to consider to obtain natural results. So at the end, we have to say what a beautiful smile, what beautiful teeth, not what a beautiful restoration. Because when we speak about restoration, in my opinion, we have already something that is not ideal. It seems fake. Okay, so starting with this idea, sometimes it can happen that we have a result like this, where we are far away from the ideal result. And then we have to understand that for us, it's in this case, it's an aesthetic failure. Other cases that we will see later are maybe more biological failure, as we'll see, or functional, aesthetic, and biological failures. And as you can see here, we are far away to an ideal target. Or situation like this, so where we have an aesthetic and biological failure, as you can see in this restoration of a single implant, where maybe the implant is perfectly integrated. We ask to the technician to do something, but at the end, maybe it's a failure, a biological failure, or in this case where we have aesthetic, functional, and biological failure, so all together. And then at a certain point, we have to wonder ourselves who is to blame. Or cases like this, where we place an implant, we take an impression, we ask for a nice and beautiful restoration, and then the technician creates something strange. But who is to blame, the clinician or the technician? Also in this case, so if we want to obtain something really nice, of course, we have the need to give the opportunity to the technician to create something ideal. And of course, in the last period, we are also fighting, say, about this kind of emergence profile that is too flat. But of course, also in this case, it can be also the technician, wrong of the technician. But of course, if we position our implant too shallow, of course, the emergence profile, it's, of course, it will become really, I would say, horizontal, something that is, as we know, not ideal in the way to prevent the perimplantitis, so bone resorption and bone loss. And then, of course, there are many different stuff. And every single time we arrive at the end, we start to, I would say, to consider who is to blame, a clinician or the lab. And then when is the time that the technician have, I would say, to redo for free, or the time that it's, say, it's our fault, and we don't know if it's our fault or not. So now we are going to consider the first important rule, the key rule. Every single time in implant dentistry, but also in prosthetic rehabilitation, every single time we start to do something, it's really important to have a treatment plan, a precise treatment plan that is considering the final target, so the final rehabilitation, and it's considering the base that we have to create. This is fundamental for us. If we don't have a clear idea in mind, so the target, it's almost impossible to obtain something predictable, okay? To do this, of course, what we have to do, we have to analyze the face of the face of the patient, and we have to start to consider the space between the lip as an empty space. And then the first is the location of the incisal edge that we can do with the different, I'll say, evaluation. For example, the rest position of the patient. After the evaluation of the ideal position of the incisal edges, we have to find the future gingival margin. So where we want to have the tissue. Doesn't matter if are there or not. Then furthermore, what we have to do, we have to consider the orientation of the occlusal plane, okay? And then with this, all these details, we can create a beautiful smile. So a smile that is related to the face of the patient. It's, I'll say, in harmony with the lips and the lips dynamics. And then we can create something really natural. After this kind of prosthetic profile, we want to have also a biological profile. So a profile that is creating the stability long-term of our restoration. Can be a single, can be a full arch, doesn't matter. And so for this, what we have to consider is to do a treatment plan. A treatment plan that always consider these aspects. So the ideal position of the incisal edge, the proportion, the future of gingival margin, and whatever we are missing, we have to recreate. We have to recreate with the biological orientation and following science in the way to obtain a predictable result long term. Okay, so this is really important, especially in implant dentistry, especially in the aesthetic zone. Then, when we start to plan, like in this case, my rehabilitation, I'm never looking the bone I have available, but I'm always looking at the ideal target. So what is the future gingival margin, the position of the incisal edges, and only in this way I can really plan how much bone I need, if I need to do a guided bone regeneration, if I need to do only connective tissue graft, or how to create this kind of scallop design that is the base for the future proportion of our restoration. So for us, this is really important every single time we start a new case and a rehabilitation. Okay, so after we plan everything, what we know is that after planning, we have to execute in a predictable way. And then what we have is static guides or dynamics guides. That like in this case, I'm planning my implant following the, I'll say, the planning that I did before, following aesthetic and this prosthetic evaluation. So remember, what is important for us is to create an important team. So between the technician that can design a perfect rehabilitation in terms of prosthetic profile, he needs many information in the way to obtain something natural. And then, of course, what you have to do after planning in a careful way, in a precise way, the position of the implant, you have to execute in a predictable way as well. So everything, it goes in one single direction of treatment planning and execute in a precise way. Of course, in the future, we will have, for sure, it will be interesting also to speak with James about the robotic surgery. It's an experience. In the future, we will be, it will be much easier for sure to place the implant as we planned in the software. And this is more or less what we have to do. Remember